This morning I will be sharing with you my informative speech for Communications 101 at Liberty University. Imagine sitting in a waiting room in a hospital all by yourself and waiting for somebody to come and tell you if your loved one died or made it or would be injured for the rest of their lives. Isn't that a terrifying thought? For me, several times in my life I've had to be in this situation, and it's really terrifying. And when you're in this situation, you're at one of the lowest points in your life, and you have to make one of two decisions. You're either going to get really mad at God and not understand why He put you there and just totally doubt His goodness and His existence and just say, I don't want to be a Christian anymore. Or you're going to be like, okay, God, I know you're always good and you're in control, and no matter what happens, I'm going to trust you. As a critical care nurse, I want to be there when people make this decision and comfort them and guide them to choose that you're hurting and you're scared, but if you trust God, it's going to be a lot easier in the long run. This morning I will share with you the credentials that you need to be a critical care nurse, and more about the profession of critical care nursing, and how being a critical care nurse can promote the values of love for others and deepening your faith in God. First, what is a critical care nurse? According to the American Association of Critical Care Nursing is the specialty within nursing that deals specifically with human response to life-threatening problems. A critical care nurse doesn't usually work in a family physician office. She usually works in large hospitals with trauma centers. Fraser Health in California cited the most common reasons for being admitted into the intensive care unit, or ICU, where critical care nurses work, as having shock, respiratory failures, infections, and bleeding. These symptoms can be brought on from a variety of reasons, from automobile accidents to allergic reactions to just really weird things that can happen sometimes. And a critical care nurse is a registered nurse, which means that she either went to school for 2 years and achieved an Associates of Nursing, or she went to school for 4 years for a Bachelor's of Nursing, and then she has to pass the NCLEX exam at the end. And after that, she's legally allowed to practice. Critical care nursing, if you know you want to go into that, you can go into special schools to be certified in things such as end-of-life care and how to do procedures that you wouldn't be doing in a family physician's office, because hopefully you're not administering feeding tubes and all that other stuff when you go in to get your checkup. While they're working in the ICU, critical care nurses do things such as assist physicians with giving medications and IVs and checking vital signs, and they also make sure that the patient's rights are respected and that family and the patients can make an informed decision. There are approximately 229,000 critical care nurses in the United States, according to the Department of Labor, and these nurses make about $63,000 a year, so it's one of the higher paid nursing professions just because of the work that they're doing. They often also have to have malpractice insurance because there's a growing trend of if something happens to the patient, that is the nurse's fault and not the doctor. So they have to stay up certified and on top of all those trends. As I said earlier, you need to pass the NCLEX after getting your nursing degree. And there's a growing demand for nurses because all the baby boomers are retiring, and so people are needing to fill these positions, and more nurses are choosing to go into less gory professions. So there's a big demand for critical care nurses. It is my hope that after I gain all these credentials, when I'm with a patient taking vital signs, I can encourage the families through my interactions with them to choose to trust God in this situation and not turn away from Him. We all know that it's really easy to believe in God and trust Him when things are going great. When you get a job promotion and your kids are doing straight A's and they just made the varsity team, it's like, shh, God's awesome, right? But when things get really bad and when we're threatened to have our children taken from us, why would God do that? It's so easy to doubt Him and just because we don't understand something to turn away from Him. Ecclesiastes 11:5 says, "Just as you do not understand the paths of the wind or how a baby grows in a mom's tummy, you can't understand the ways of the Lord." And in Jeremiah and Romans, we're told that all things work together for good, even if we don't understand it. It might be 20 years from now, but somehow, if we just trust God, everything will work out. My friend Amy Phillips is a critical care nurse down in Virginia, and she's also a Christian. And she explained that you don't go up to somebody who's in this situation and start telling them that God's good, because they're not going to want to listen. They're looking at their child or their loved one who might die, and the last thing they want to hear is that this is good. So she says that you just talk to them and encourage them and serve them. And the talk of God and an afterlife usually comes up during these situations. So if you build a relationship by talking with them and caring for them, eventually faith will come up and you'll be able to share, I'll be able to share my experiences and that they should trust in God. But I can only build this relationship with them if I choose to serve them and love them. So God is the ultimate example of love that's seen through everything that He did for us, and ultimately Jesus dying. And He also runs to the broken. He loves to be with people who are hurting and to encourage them and to build them up. I'll be working with broken people and broken people's families, and so I'll have an awesome opportunity to serve them. I should always serve them, always asking if there's anything I can do for them or anything I can get them or anything that I can explain for them better. And even if they're grumpy and mean, as some people can be when they're really stressed out, I can't be mean back. I have to continue to serve them and love them, like it says in 1 Corinthians, where love is patient and kind and not slow to anger. Even those are difficult when people aren't being nice to you. That's what I have to do so I can build that relationship with them. Along with giving medicine and helping patients, I most importantly want to minister to families as a critical care nurse after I've gained all of my credentials to be able to do this. I want to be able to be there to encourage people in these difficult times to trust God. And since there's a growing demand for nurses, I believe that with my education and my drive, I can do this. And I'm excited to do this, to encourage people to trust God during these difficult times. I want to thank you all for coming this morning and listening to my informative speech for Liberty University. And it's my hope that after learning about critical care nursing, you have a greater understanding of the work that critical care nurses do and how I can use this profession to bring glory to God by loving families and encourage them to trust Him. Thank you.
Very good.